Hello, everyone, and welcome back to Fluent English Plus, your go-to channel for improving your English skills while learning about important global topics. I hope you're all doing well. In today's video, we are diving deep into a topic that has affected every single one of us in some way. The virus that caused one of the most devastating pandemics in modern history. We'll explore its origin, how it spread worldwide, the catastrophic consequences of the outbreak, the global race to develop vaccines, and how things stand in 2025. This video is packed with information and essential vocabulary. So stay tuned and let's begin. The virus that turned the world upside down is called SARS-CoV-2, which causes the disease known as COVID-19. It was first identified in December 2019 in the city of Wuhan in Hubei province, China. Early reports indicated that the virus may have originated from a seafood market where live animals were also sold. Scientists believe that the virus likely jumped from animals to humans, possibly through an intermediate host, like a pangolin or bat. The concept of zoonotic spillover became a major topic of interest. Research into the origins of SARS-CoV-2 is ongoing. Some theories, such as laboratory leak hypotheses, have sparked controversy and international debate. However, the majority of scientific consensus leans towards a natural origin. Genomic sequencing and comparative studies with similar viruses found in bats have provided evidence supporting this view. What made SARS-CoV-2 particularly dangerous was how easily it spread from person to person. Air travel and globalization accelerated its transmission. Within just a few months, it had spread to nearly every country. The virus could be transmitted through respiratory droplets, aerosols, and contaminated surfaces. Asymptomatic carriers also contributed significantly to its global spread. Lockdowns, travel bans, social distancing measures, and mandatory mask wearing became the new norm across the world. Cities turned into ghost towns, economies slowed down, and health systems were overwhelmed. Quarantine protocols were established for international travelers, and public health messaging became a crucial tool in fighting misinformation. Different countries adopted different strategies. New Zealand, for instance, implemented an elimination strategy with strict lockdowns, while Sweden opted for a more relaxed approach. These strategies led to a global conversation on balancing public health with economic and personal freedoms. The consequences were staggering. By the end of 2020, over 80 million cases had been reported globally, with more than 1.8 million deaths. Countries like the United States, Brazil, India, and Italy were severely hit. Hospitals ran out of beds. Ventilators and protective equipment were in short supply. Doctors and nurses worked around the clock, often risking their own lives. Mental health issues skyrocketed. Students around the world transitioned to online learning, and millions of people lost their jobs. Economically, the global GDP shrank by around 3.5% in 2020. Industries such as tourism, aviation, and hospitality were among the worst affected. Global supply chains were disrupted, and businesses had to adapt to remote work environments almost overnight. The social impacts were also profound. People were isolated from loved ones, and celebrations, funerals, and religious events were postponed or held virtually. Domestic violence increased in many places due to lockdowns. Vulnerable populations, especially the elderly and those with pre existing conditions, faced increased risks. In the realm of politics, the pandemic exposed weaknesses in global cooperation and governance. Some governments gained praise for their quick and transparent responses, while others faced criticism for denial and mismanagement. Amidst the chaos, the scientific community rallied like never before. Researchers from all over the world began working on a vaccine. By the end of 2020, the first vaccines, including Pfizer BioNTech and Moderna, received emergency use authorization. The speed at which vaccines were developed was unprecedented. Normally, vaccines take years, even decades, to develop. Thanks to mRNA technology and significant funding, vaccines were developed and distributed within a year. Massive vaccination campaigns were launched. Governments coordinated efforts to ensure the public received the vaccines. By the end of 2021, billions of doses had been administered. While variants continued to pose a challenge, the vaccines significantly reduced severe illness and death. COVAX, an initiative by WHO, Gavi, and CEPI, aimed to provide equitable vaccine access to low-income countries. Despite initial setbacks, COVAX played a key role in global vaccine distribution. Challenges included misinformation about vaccines, vaccine hesitancy, logistical issues in storage and distribution, and geopolitical tensions. Booster doses were developed to address the waning immunity and emerging variants like Delta and Omicron. Vaccines helped societies gradually reopen. Schools resumed in-person classes, businesses reopened, and people could once again see their loved ones. As of 2025, life has returned to a more stable state, but the virus has not been eradicated. New variants occasionally emerge, and localized outbreaks still occur. However, most people have developed immunity either through vaccination or previous infection. Booster shots have become part of the annual healthcare routine, much like flu shots. Surveillance systems have improved, allowing for quicker responses to new threats. Governments now keep emergency response plans updated, and stockpiles of essential medical supplies are better maintained. The healthcare infrastructure has been reinforced in many countries. Recently, however, there have been signs of a resurgence in certain regions due to a new variant named Pi 3. This variant shows signs of higher transmissibility but lower fatality. Nevertheless, experts caution that underestimating it could lead to another global crisis. Public health authorities are urging people to remain cautious. Mask mandates in high-risk areas, testing, and travel monitoring have been reinstated in some regions. To protect yourself and others, continue to practice good hygiene, wash hands frequently, and use hand sanitizer. Wear masks in crowded or poorly ventilated spaces. Get vaccinated and stay updated with booster shots. Avoid contact with sick individuals. Maintain a healthy lifestyle to boost your immune system. Keep informed through reliable health authorities such as WHO and CDC. If you suspect you are infected, isolate yourself immediately. Get tested as soon as possible. Inform those you've been in contact with. Follow medical advice and monitor your symptoms closely. Use telehealth services to avoid unnecessary hospital visits. Keep a health journal of your symptoms and medication. Seek medical attention if you experience severe symptoms like difficulty breathing, chest pain, or confusion. It's essential to act early to prevent complications. Many who recovered from the virus continued to experience symptoms weeks or even months later. This condition is known as long COVID. Symptoms include fatigue, brain fog, muscle pain, and respiratory issues. Rehabilitation programs and awareness campaigns have been introduced to support long COVID patients. Workplaces are now more flexible in supporting employees with long-term symptoms, and insurance companies have begun to update policies to cover long COVID treatments. Thank you for watching this comprehensive video on the virus and its impact on our world. From its mysterious origins to the current challenges we face in 2025, we have witnessed how interconnected and vulnerable our world is, but also how resilient, innovative, and compassionate people can be. The pandemic taught us many lessons: the value of science, the need for global cooperation, and the importance of preparedness. It also reminded us of the simple joys of life and the power of human connection. I hope you found this information valuable and that it helps you stay safe and informed. Don't forget to like, share, and subscribe to Fluent English Plus for more content that helps you improve your English while learning about the world. If you have any questions or want to share your experience during the pandemic, leave a comment below. Stay healthy, stay informed, and until next time, take care and keep learning. Bye for now.